It's just going to be 5 or 10 minutes, and it's just a sort of promotion, just to tell people that we exist, because we have quite a small YouTube channel, and we're trying to sort of build it up. Okay, so let's get started, guys. I'm going to start the recording, and just be ready. If you hear your name, please answer. So 3, 2, 1, go. All right, so this is OET speaking. We're looking at information gathering today. It's an input session, which means we're just going to focus on understanding what OET want to see. So in this class, guys, we'll just talk about what is it to gather information. Then we'll make a quick diagram. I have an activity actually in groups, so there'll be a group activity. And finally, because I've been doing this so long, it's normally a good idea to talk about the errors. You just see the same errors all the time, guys. So at the end of the class, we'll talk about what are the most common errors that you always hear students making. Okay, so let's get started. I'm going to start with someone like, if it's okay, maybe Fumi. Would you mind, Fumi, or Metap? If it's all
Yeah.
right, we're going to go slowly, don't worry. What is information gathering? Do you know what it is?
Yes, it's like asking question to patients, to listening to their story, why they are here, what is the
Listening
problem.
to their story. Okay, so listening to their story. Now, I suppose yes, listening to their story. Barnes, do you want to add something to this?
Maybe find out what patient knows.
Finding out what they know already. Yeah, I mean, guys, this is about, if we're gathering information, it's about asking questions to the patient, finding out what they know. Finding out what they know. Could be. Mohammed Ali, do you want to add to this?
Yeah, asking open questions to your patient
Okay, so
and not interrupting them while they are speaking.
example, open to closed questions. This would be a good example of information gathering. So, Kushbu, could you give me an example of an open question? Or Rima?
Yes. Could you tell me about your details?
Could you tell me about your details?
No.
About
We can
your,
ask them, could you please explain the pain you are experiencing?
well, to explain the pain, that sounds a bit strange. Like, how can they're not doctors. They cannot explain. They can describe it, but they
Describe it.
can't explain it.
Describe
This one's good though. Could you tell me, guys, what's missing here? One word. Could you tell me
More about.
More
about.
And this could be symptoms,
Or
condition,
condition.
problem, injury, whatever, right? So this is open. And an example of a closed one, Alessia, could you give me a closed one?
Yes. Could you be more specific and tell what you want to find out precisely? Could you be more specific on?
That sounds open to me though, because remember, Alessia, a closed question is like a yes/no question usually. So what is a yes/no question? How does it start? Alessia, Mizgin?
Yes, I'm here.
Give you a clue. It's going to be are you, do you, have you? Like,
Have you pain? Do you experience pain in this district of your body, in this part of your body?
do you experience pain? Let's say in this part of your body. Okay. So guys, this is just an example of information gathering. Open questions are questions where, Alexi, what is an open question, Murad? It's not yes, no, is it? What is an open question? Alexi, you want to try this? Khadija? Ali, what is an open question? Quickly, please. It's a really easy question, this. Belkis, what is an open question, please?
Open question we can at the start.
We should ask them at the start. We'll
At
talk
the
about that
start,
later.
yeah.
But why is it, Belkis, why is it open?
It's open to let the patient explain those symptoms and the pain, something to more information we collect from them.
Okay, it lets them. Yeah. Guys, look, an open question, it's not controlling the answer. Do you see what I mean? Like,
Yeah, those things we allow the patient to explain what's going on with the symptoms and the pain or something.
like, for example, Belkis, if I say, what time did you get up today? What time did you wake up?
It's a close, it's a not no, open, it's a closed question. Just
Yeah,
patient
why is it closed? Why is it closed?
because it's a short answer.
It's not so much the shortness, guys. It's the fact that what type of word do I want? If I say what time, she has to give me a number, right?
Yeah.
But if I say, tell me more about your morning, it's not a yes/no situation. It's not a number situation. So open questions, we're not controlling what they say. But closed questions, it's going to be yes or no.
Or a number.
Or I call these quantity questions, could be numbers, right? Like how many apples did you eat? That's a closed question. Okay, so guys, this is probably the most important thing in OET for information gathering. Open and closed questions. Basically, information gathering is asking questions. In my opinion, in general, that is one of the most important things that we've got to do, okay? But this is in general, okay? What about OET? This is an OET exam. Barnas, could you say hello, Barnas?
Hello.
Do OET say anything more specific about information gathering? OET said it.
OET wants to start with open questions to close questions.
Is this the only thing that OET say, though? How many guys, how many points do OET make about this? Does anyone-
5.
Is it 5 or 4? Barnas?
5. So
There's actually, I think, 5. There's 5, I think. Shall we look at them? Because for me, this is the most important thing. And this week you can practice this. But OET actually say there's 5 elements or aspects to information gathering. So we're going to look at all of them today. What are they? What are they? Does anyone know already? Fareed might know. Fareed, do you remember any of these? What are the points that OET make about this? There's 5. Metap, could you tell me one?
yes, like not using compound question.
Yeah, there's compound question. I don't know which number it is, so we'll say no compound. What does compound mean?
Like asking one question, didn't want to wait to answer, ask again to another question, like.
So 2 questions at the same time, actually. Yeah, almost right there. Does anyone else know anything else that they say? Toshita, do you know what OET say? Yeah?
I think the first one is active listening with no interruptions.
Active listening sounds right. So active listening. Let's have some more. Fumi, Hussein, Simona. What else do we have?
Can I add something?
You can, Nazifa, go on. I didn't realize you were here. Yes,
Yes.
Nazifa.
Yeah, we should start from open to close.
Open to close questions, exactly. So this is OET say that this is important. This is only one thing, right? Guys, in general, asking questions, open to close questions, in general, that, to me, that's information gathering. Is very important. But actually, OET are saying 5 things. Active listening,
Another
no
thing
compound
is,
questions. What else? Go on. No, yeah, if you know.
another thing is minimizing the interruption. I mean,
They don't. I mean, Sort of, but they don't directly say that actually. Aishat, what else is there?
Summarizing.
Summarizing. Is that right, guys? Summarizing?
Yeah, summarizing. Yeah.
Yes.
It is one. It is one. There's one more. Muhammad Ali, do you know the other one?
Clarifying.
Oh, go on. Everyone, does anyone know the fifth one?
Clarifying.
To clarify. Yeah.
Clarify. Yeah.
Taking to understand.
Now, don't worry. Maybe some people here are thinking, what is he talking about here? We're going to look at all of these, okay? And we're going to learn all of them. 1, 2, 3, 4, 5. Don't worry, okay? But basically, OET are saying that there are 5 things you can do in your exam to increase your score in information gathering, okay? Do I need to do these things all the time? No. No, okay? So we'll talk about that as well. But guys, I have a diagram. Can we look at this diagram together? Is everyone ready to see my diagram?
Yes.
Yes.
So this is verbatim OET now. This is a good word for you guys, verbatim. Simona, do you know what this is, verbatim?
No, to be honest, no.
Does anyone here know verbatim? It's a high level word. Nazifa, do you know verbatim?
I'm sorry, no.
Aha. Farid might know.
This is how it is written, like the way you just cut it out from OET directly.
Excellent, sir. Guys, it's like copy paste from OET, verbatim, right? It's like exactly the words of OET. Okay, so not my words. This is now OET words. So D1, facilitating the patient's narrative and active listening techniques. This is from OET. Okay, I want to try a little activity. Okay, we're going to try an activity today. The activity is this. In groups, you will try to match, okay? You will try to match D1, D2, D3 to my examples, okay? D3, D4, D5 to my examples. Where are my examples? Well, they are here, okay? So these examples need to be matched to the descriptions. Okay, so for example, facilitating the patient's narrative. Is this an example of facilitating the patient's narrative?
No, indicating.
No, right? Because I'm mixing them. You need to decide which one is D1. Okay, I'm going to put you guys into groups. Don't worry, you can have a chat about it in groups. I want you to match the examples. These are the examples to the OET descriptions. Okay, is everyone ready to go into groups?
Yes.
Yes.
Okay. Have a chat. Turn on your microphones. Don't be afraid to speak. The rooms are opening now. Just go in there and just have a chat. And I'm going to put this here. I'll put this in red. Okay, so if you're watching on YouTube, we do classes like this every day. Lots of nurses and doctors talking. It's very communicative. In this class, they are trying to match these examples to these official OET criteria. When they come back, they will be, we'll make this more simple and we'll discuss the examples. Okay, can I ask you all just to finish your discussions and come back into the main room? All right, so we've got about 23 people here. Can everyone hear my voice? Can you guys all see me?
Yeah, we can see you.
Yeah.
Okay, fantastic. So what I want to do here is we're going to match the examples, but we are also going to make this OET language, we're going to make it more simple, okay? Because we cannot study this. This is not for students, it's for teachers. It's very technical jargon language. So I'm going to ask different people to help me. So we'll start with Dylan. Dylan, could you say hello?
Hello.
Dylan, what does this mean, facilitating the patient's narrative? What does that actually mean?
Oh, I'm sorry. The door knocking now.
Oh,
Oh, I'm sorry. I'm sorry.
No problem, no problem. It's
Okay.
the problems with Zoom.
Yeah.
iChat, could you help us with this? Could we have Nazifa?
Yeah, initiate active listening.
So initiate. Is that what you said? Initiate. Well, do we need this word initiate, guys? I don't think we need any of this. We just need
Active
Active listening.
So, Simona, tell me, what is active listening? What is that?
For example, when the patient describes how he's feeling, I have to say, I see, okay, all right.
Okay, so which one of these is an example of active listening?
Oh, I see, okay, painful, right?
Okay, okay. Active listening is just making sounds like, I see. Okay, right. But what's this one? Can anyone tell me? Maybe Kadriye or Nihan? What's this one? It's a little bit more than just making sounds. This one.
Yes,
Yeah,
active
echoing.
listening.
It's echoing.
Echoing.
Echoing, yeah.
What is echoing, Kadriye? Can you tell us what
Yeah,
this is?
repeating phrases that the patient says.
So guys, repeating phrases that the patient says, this is active listening. It's like basically showing them you are listening. Does that make sense, guys? Showing them you are listening. So, I see, but you can also use their words. Okay, I'm going to call this one just sounds. I see. This kind of thing. But we can also do echoing. Kadriye, could we demonstrate echoing together if I'm your patient? Would that be okay?
Okay.
Okay, so you ask me how I'm feeling, and then I'll talk. Guys, listen to Kadriye. She's going to give you an example of active listening. Okay, 3, 2, 1. Kadriye, go.
Okay, Ellen, how are you feeling today?
Well, I've got this very painful headache, and it's been going on a long time, and I'm not sleeping very well. And my wife is very worried, and at work it's also very stressful as well.
Yeah, okay. Headache and long time, right?
Okay, now, so guys, did we hear some sounds there? Did she make some sounds like
Yes.
Yes.
Now, did she do echoing though?
No.
Yeah, was that echoing?
No, it's like looks like summarizing.
Yeah, it starts to sound like summarizing, Krujia. You need to say these things at the same time, okay?
Yeah.
If you say it at the end, it's more like summarizing, which is going to be another one. It's not bad. It's more like D5, but it doesn't. You need to make a full sentence, okay?
Okay.
One more time. Make these during, okay? Guys, listen to this. So nurse, I have a really painful headache, and it's been going on a long time.
Long time.
I'm not sleeping very well.
You are not sleeping, okay.
My wife is very worried.
Okay, I see.
There we go. Very, very nice. Okay. Now let's move on to D2. Hussein, maybe you could help us with D2. Jafet, Abdul Bari. Can you make this more simple, Hussein? What is this? Muhammad Ali, what is this?
I think starting open question and move to the closed question.
And we already spoke about this, guys, didn't we? Everyone, we spoke about this already. Now, which one is an example of that, though? Barnas, can you tell me which example is the open to closed?
So I think the second one.
So
Could you tell me about?
already? Yeah, this.
Yeah, yeah.
Is he right, guys? Is this open and then closed?
Yes, he is right.
Yeah, correct.
The first one is open, last is closed.
Okay, so when did it start? It's like a number question, quantitative question. Okay, so guys, this week we will do a lot of work on this. Doctors, so important. D2. I mean, can anything be more important than this, really, in terms of communication? Maybe checking is as important as this. Murad, you have a question, sir.
Yes, why it's not the last one?
This is not in order. Okay.
Yeah, I see. I mean, D2, why it's not the last one? How are you feeling today? And when did the pain start?
Right. Oh, sorry. I see what you mean. Because, Murad, this is an example of two questions at the same time. Okay. Here, Murad, we have to stop. It's a very good question. We have to stop and wait for the answer here. Okay. What do we call it when we do not stop?
Compound
question.
So that is a compound question, which is D3. Murad, you're not allowed to ask two questions at the same time.
Yes, I know that. I know.
Okay, sorry. Well, I'm when I talk to you, I'm also talking to everyone. Guys, we can't do this. Murad, give me an example of a compound question. Give me another example.
Okay. So, can you tell me how I'm feeling today and when you started experiencing this kind of pain?
Yeah, something like that. Anytime, guys, you're doing two questions, it's bad. You cannot say, when did it start? And are you taking any medication? Or do you have a family history of this? And tell me more about your wife's problems. You can't do this. Why are we not allowed? I'll ask him again. Murad, why can I not ask two questions at the same time? Why is that?
To not confusing patient, maybe.
I don't think it's necessarily confusing. Anyone else? Abdul Bari, why can we not do this?
Because maybe patient answered the one question, maybe didn't answer the second question, forgot.
Yeah, I think that's the idea, guys. The idea is that they might not answer both questions, and then you move on without getting your answers. Okay, so no compound question means, guys, no two questions same time. Okay, but what is a leading question? Atik, Fadila, what is a leading question? Any ideas?
Like encourage
Build up.
Just Fadila.
Build up.
What is a leading question?
It's building up a conversation.
Building up. Kind of. To lead is to build up, kind of. But that doesn't really explain it. Metap, what is a leading question?
It's like you want to some answer, you will ask the answer in the question, like your pain is your leg is painful, right? It is like that.
Right.
You want exactly this answer.
So we could say, guys, I think she's saying it very well there. No questions where you are guiding the answer, could we say? You are forcing an answer.
Affirmative answer.
Only one possible answer. Okay. So this is called a leading question. Like I might say to Kadriye, oh, you're feeling better now, aren't you?
Yeah, I
Right?
have to say, yeah.
It feels like under pressure to say yes.
Yes.
Sense? No questions where you, oh, that's a good way to say it, where you pressure them for one answer. I'll give you a good one for me, for example. I could say, can we speak to Ilona? This is a good example.
Yes.
You are enjoying my class now, aren't you?
Yes.
she cannot say, it would be too rude. She cannot say no, right? Even if she thinks that. That is a leading question. You cannot pressure people to answer in one way or the other way. So you're enjoying my class now, aren't you?
Very it's true, Ellen.
Now, well, what do we call this? Farid, Dilan, Barnas. This, you know, like if you say
affirmative answer.
It is a
affirmative question.
Well, I'm just going to ask for Sarah. How about Sarah Begum? It is a good treatment, isn't it? What do we call it? Muhammad Ali, what do we call this?
Is it a negative interrogation, like question?
Tag question.
It has a name. I'm listening. Does anyone know the official name?
Tag question. Tag.
Question tag.
And we use this in the hypnotism.
Really?
Yes. Yes. To
suggestion.
make the idea in their subconscious mind. Tell him, aren't. He say yes.
Brilliant. Because guys, Farid is like a psychologist, I think, clinical psychologist, Farid. So also, I know that you're very interested in these things. So guys, look, anyway, normally I never really hear this, but just try to avoid any kind of question where you're pressuring an answer. Okay. And whose iPhone? Do you have a question? iPhone.
It's me. Just to I want to share this idea. When we want to make someone what we want, use the tag question, but don't use it in the normal life because this is very technical to persuade someone. Because this is a kind of dark psychology. What I want, I can make you through some technical language. I can use, and especially we use in the marketing and shops. We use this kind of language to make someone convince.
Convince them. Okay, very interesting. Okay, so guys, just remember in the exam, do not do this. Try to avoid it. Riri, could you say hello for D4, Riri? Riri or Yahya? I think you are. You came last week. Is it Yahya?
Yeah.
What does that mean? Clarifying statements which are vague or in need of amplification. What does that mean, really? Can we summarize this? What does it mean? Not sure?
Honestly, I don't know.
Well, what's the most important word here? Everyone, what's the most
clarifying?
Clarifying.
So I just think we just need to have clarifying statements, right? If you feel like that they did not say enough, or if you feel like that they not very clear, could happen.
Unclear, yeah.
You need to just check, get them to clarify. What does that mean? Berry, Kadriye, clarify. What does that mean? Taybet.
Explain the
more explanation.
Well, it's not really explain. You need to you make them explain, guys, right? So it's like make clear.
Yeah.
Right?
Make easier.
Patient statements. So basically, you're going to ask them. So which one is that here? Which one is making clear patient statement?
Okay, so what do you mean by
like, right? So Berry, I might say, okay, can I ask you what you mean by painful? Right?
Annoying.
Can I ask you what you mean by irritating? Or when you say problem, what can you explain it a bit more? Like that. So these kind of things you can score in OET. You just say this phrase at the right time and then you're scoring. Okay, Zargona, could you say hello?
Yes, hello.
So obviously, D5 is this. So what is D5? What does it mean?
D5. Okay, make clear.
D5, D4, D5, this one.
Okay, today. I think it's okay, so today we talk about
Yes, no, it must be this. But what does that mean? Can you summarize it for me? Like what does that summarizing information to encourage correction, invite further information is very technical language. Can we make it more simple? Everyone, can we make this more simple?
No, I'm not sure. Sorry.
No.
Summarizing the conversation.
Yeah, we
Summarize
can
the conversation.
summarize
We can
what we
we can
talked about.
repeat we
Exactly.
can repeat the information that the patient give us, and we
Which
will
is
check it.
summarizing. Exactly, Nazifa. So, Nazifa, what does summarize mean?
To make a summary of the information that the patient mentioned, like this.
Guys,
Explanation in short, not.
this might be very useful in the writing as well, right? What does summarize really mean?
To make a story?
Well,
Concise.
We can talk about three.
There's many different ones, but I think the best thing here is just to say main idea. Summarizing is main idea.
Yeah, we can talk about three topics.
Brief
three
idea.
Main topics.
Main topics, main ideas, guys, and check. So look, okay, today we talked about your medication and your new symptoms. Would you like to add anything? I suppose it's check for additions. Okay. So at the end of your dialogue, or maybe in the middle, you might ask them, you might summarize the topics, the main ideas, the themes. And then you might ask them if they want to add any extra in. Okay. Dylan, do you have a question here?
Yes, I have. We use summarizing in providing structure and information gathering. What difference between that?
Yeah, and well, there's a lot of crossover basically. What's the difference? Sometimes there isn't much of a difference.
Not differences.
Yes.
Look, why is it like that? Why is there crossover? I'll tell you why it's like that if you want to know. Okay, has anyone heard of the Cambridge-Calgary Guide? I think I mentioned it last week.
Yeah, last 2
Calgary
weeks.
Guide. Okay, so Mohammed Ali, what is the Cambridge-Calgary Guide?
I think it's like when you start the conversation, up to where to start and where to end.
Sort of, but in more generally, guys, the Cambridge-Calgary Guide, is it a language test? No. This is
speaking.
This is a book that native speakers are taught from. So native speaking doctors and nurses, many of them will study this. Can anyone see this? So this is like, say, an English doctor. An English doctor will study this very often. It's not really about language. What is this telling me?
Order.
Yeah, this is like how to do a consultation, isn't it? It's like consultation, how to, the order of a consultation. So OET is based on this. Can you guys not see? Information, gather information, provide structure. Okay, so why do they overlap, Dylan? Because OET is based on this. It's like they took this and they changed it for language test, for a language test.
Oh, okay.
Because they changed it, it's like, for example, does anyone know UIPP?
Yes.
What is
information providing?
Understanding cooperation, patient perspective.
Does anyone
Perspective,
see? Does anyone see that here?
Yeah.
No, it's not there. Okay,
No.
why? Why? Because that is inside here. It's inside.
Gather information, yeah.
So things like that, that's why there's repetition, I think, because they adapted this thing. But on the positive side, guys, what you're studying here is not just for the OET exam. It's something that any native speaking doctor would be training. Okay, it's just slightly different in OET, a little bit different. Anyway, so guys, we've got about 8 minutes left. This week, I want you guys to study this week. Please study this before next class. So just review it, okay? You will be trying to practice doing some of these things, okay? You will be trying tomorrow in groups, Wednesday in groups, Thursday in groups, practicing. But I want to talk now, just to finish, on the common errors. What are the common errors with this? First thing is, actually, let's just remind everyone, do I need to do these things all the time?
No.
Who said no?
Kadri.
Yeah, we need all the time.
Why do we not need to do them all? No, well, I would say no.
Yeah, because summarizing, it's not necessary every time. Maybe we will not have time in the real exam for summarizing.
Maybe no time, true.
Yes, and it's not necessary maybe for the cue card.
Like D4, guys, we cannot do D4
Yeah.
unless the patient is not clear, right? Maybe the patient is very, very
Very
clear.
clear, yeah. But active listening, yes. Open questions, closed questions, yes, I think.
Maybe this one. She's right, actually. What do you think, guys? Probably these ones, we always do them.
Yes, I agree with
Probably more or less, more or less. Okay, so don't think, everyone, do not think that you have to do all of these things all the time. You only do them when you can, when it's the right moment. Probably these we do almost all the time, but maybe even there could be a situation maybe where you do not do this. Okay. Everything is about the situation. The situation. Okay. Now, what are the common errors therefore? Can anyone think about what might be some common mistakes that people make with this? Probably mistake number one, try to do everything all the time, right? You don't need to do this if it's not needed. Okay, you don't need to summarize if it's not needed. Aisha, can you think of any other errors, any other common errors?
Yes, asking more than one question at a time.
Yes, so D3, guys, is a very, very important compound questions. Compound questions, very common error, okay? I often do compound questions, so compound is a very common mistake. Muhammad Ali, can you think of any other mistakes?
I think disturbing the patient while they're speaking.
So interrupting the patient,
Yeah.
it's not actually that common. I tend to find that nurses and doctors are they think that they don't normally do that. It can be an error, but it's not very normal. Barnas, do you have any? We want the most common errors.
I think mixing the open and closed questions.
A big problem is with the open and the closed. Okay, guys, a big problem is with D3, D2. Sorry. Let's talk about that later. Is there any other problems, guys? Any other problems?
Maybe repetitive, much more about echoing, maybe repeating.
Maybe it's not too bad. I don't tend to hear that. You guys, very often you don't hear echoing. I never really hear echoing. So if you want to practice echoing, guys, it's not a mistake though. Anyone else before I tell you? Okay, let me go into it. The most common error is with open and closed questions, as Barnas said. But what is the error?
Starting with the closed.
Yeah, starting with closed.
Start with closed and finish with open.
Starting with a closed question. That's slightly different. Starting with a closed question. We don't start the dialogues with closed questions. Do you have any pain? That is not your first question. What's your first question, guys, at the start? Everyone.
Open question.
How are you feeling today?
Open
How are you
question.
feeling today?
Well,
Could
tell
you
me a
tell
bit
me,
more.
could you tell me a bit more about your symptom?
Guys, start open, right? How are you feeling today? Why do you think you are experiencing these symptoms? Tell me more about that. Okay, then closed. Do you? Are you? Have you? But that's not the main error. The main error, guys, is something that you can work on, I hope, this week. And it's one of the most common problems, actually, in OET. Some patients are very shy. Some patients don't want to talk to you. Some patients do want to talk to you. Okay, so you have shy patients, or let's say untalkative patients, and you have talkative patients. What is a talkative patient? Dr. Habib, what is talkative? What is untalkative? Alona, what is talkative and untalkative?
Who talks a lot?
Just Alona? No?
Talkative is the person who keeps on talking all the time.
You're talking a lot. And then an untalkative, or we can say shy, I suppose, if you want, not talking a lot. Okay, so why is this important for D2? Nihan, why is it going to affect the way I do D2, open and closed questions?
Because we are waiting explain from patient. Patient needs to be explained to us, and then we need to learn the issue.
Okay.
If patient is shy, we can't learn too much things, I think.
Well, we might not learn too many things, Nihan, if we are not very good students or if we did not study. If you have a shy patient, you can still learn a lot of things. What you need to do, guys, with a shy patient is open, and maybe, I don't know, maybe 3 open questions, right? Keep pushing. Tell me more about that. Why? Tell me more, right? Then you can move to your closed questions. Okay? So basically, in shy patients, we're going to ask more open questions. Very simple. But it's not easy to do it sometimes. It's not always so easy. Okay, what about a patient who is talking? How many open questions do I need? Maybe one.
One, yeah.
One enough.
And closed, and then maybe 2 or 3 closed. If they're telling me everything I need to know already, you don't need to ask so many open questions, okay? So this is what we're going to work on this week. I'll tell Lawrence to focus on this. How much information? Remember, what are we studying? Information gathering, right? What does gathering mean, guys?
Pick up.
Pick up?
Collecting.
It's collecting, isn't it? We can say it's collecting information about the patient. So if you ask them one time and they tell you everything, you don't need to be asking so many open questions. So that's the big mistake for me. Many students, when they get a shy patient, they don't know what to do. But what's the solution? Keep asking open questions until they speak. Does that make sense, everyone? Tell me more about that. Why is that? Okay, tell me more. Keep pushing. Okay, I need to finish now because the next class is coming, but come back tomorrow and we will practice information gathering in groups. Okay, guys?
Thank you.
Thank you very much for your time.
Thank you very much.
Well, enjoy the next class and thank you.